Hi SD fans and welcome back. We've been working with the team at Divers Alert Network for several years now, and over the coming months I aim to share some of their knowledge and expertise when it comes to medical ailments and conditions and scuba diving, starting with depression, medications for depression and fitness to dive. For those here for the first time, my name is Mark, I'm the Editor-in-Chief of the Scuba Diver media brand, and welcome to the Scuba Diver YouTube channel. Take 2 seconds, hit that subscribe button so you don't miss out on any of our future videos. And ring that bell so you get notification of the latest releases. Want some free stuff? Everyone loves free, right? Check out the description below for all sorts of goodies, like a free digital subscription to any of our magazines. Where we can, we'll link you to the destinations or equipment we talk about in the support our channel section in the description. For transparency, we'll earn a small commission each time you purchase after clicking one of our links, and this will go directly back into making more content for you to enjoy. Now, let's dive into the video. Who gets depressed? It's not as uncommon as you may think, especially given the current state of the world with the COVID-19 pandemic. Even divers get depressed. Some of the more frequently asked questions on the Dan Medical Information line concern medications divers take for depression and how these drugs can affect their fitness to dive. According to the National Institute of Mental Health, each year more than 17 million Americans experience a period of clinical depression. Fortunately, with appropriate treatment, nearly 80% of those diagnosed with depression experience significant improvement. Depression isn't simply in your head. It affects both body and mind. Symptoms of depression vary from person to person, as does their severity. Obviously, those individuals who are out of touch with reality, are suicidal or have hallucinations should not dive. Also, any condition that could affect one's physical or rational decision-making ability would not be safe for the diver or their buddy. However, many people dive successfully while they take medication and receive treatment for everyday depression. According to the National Depression and Manic Depression Association, some symptoms of depression include prolonged sadness or unexplained crying spells, significant changes in appetite and sleep patterns, irritability, anger, worry, agitation and anxiety, and an inability to concentrate and indecisiveness, unexplained aches and pains, reoccurring thoughts of death and suicide. For divers, here's an extra consideration. Some of the symptoms associated with depression could also mimic those of decompression illness. Unexplained aches and pains or an inability to concentrate could make a differential diagnosis very difficult. Diving at depth is not a place to lose focus on the immediate dive tasks, following a dive plan, monitoring your air supply, or just being an observant dive buddy. Should divers with depression be cleared to dive? Yes and no. Each diver should be considered on an individual case-by-case basis. Factors should include each diver's medical history, type and dosage of the medication, the individual's response to treatment, and motivation for diving. In-water safety for the diver and buddy is a primary consideration. Part of the treatment for depression can include the use of central nervous system medications that have varying but similar side effects. Dozens of antidepressant medications currently on the market effectively treat depression. Each group has its own distinct properties that react chemically in the brain, but unfortunately for divers, some medications have side effects similar to the symptoms of decompression illness. Side effects such as visual disturbances, weakness, dizziness, lack of coordination, numbness and tingling, when occurring after a dive, may require evaluation for possible DCI. Sometimes finding the optimal medication involves trial and error. People should never change doses or discontinue medication without direction from their physicians. Individual reactions and effective therapy may take several weeks, even months to achieve, so any diving would have to be postponed until the patient has adjusted to the medication. The following are the most common medications used in treating depression. SSRIs, selective serotonin reuptake inhibitors. Although these typically cost more than other antidepressant medication, they tend to be relatively safe for divers. They do, however, have a side effect of drowsiness, and this can influence the safety of the dive. ICAs and HCAs, tricyclics, tetracyclics and heterocyclics. Dizziness, drowsiness and blurred vision may be among side effects from TCAs and HCAs. Any medications that affect concentration, decrease alertness or impair decision making are not compatible with safe diving. Other antidepressants such as bupropion, trazodone and venlafaxine, they can cause fainting, excitability, difficulty in breathing. They may have side effects of agitation, CNS stimulation, seizures, psychosis, dry mouth, headache, migraine, nausea, vomiting, rash, muscle pain and dizziness. Obviously, a diver with these symptoms could experience safety risks. For divers, there's very little research about diving with depression or diving while taking antidepressants. While divers take CNS medications, report problems while diving most commonly come of nitrogen and the side effects of the drugs. The diver should discuss the possibility of seizures with a doctor. Every case should be evaluated independently with honest communication from the diver or prospective diver, a physician and the training organisation. Divers who respond well to medication over a long period, have appropriate decision-making abilities and are cognizant of potential side effects may be considered for some types of diving. But this should be a joint decision reached by the diver and the physician. Got a medical query? Leave your question below. If we or the team at DAN can't answer, maybe someone in our community will be able to help out. Remember, if you enjoyed this video, be sure to subscribe to our YouTube channel and check out our playlist for more inspirational and educational content. As always, stay safe, and if you're going diving soon, enjoy.